a bigger part of the problem was showing improvement in untreatable neurological disease that was the signature diagnosis of the Undersea and hyperbaric medicine specialty, in other words, decompression sickness, was an affront to the specialty. Here was 100 years of diving medicine, and I was standing up as new kid on the block, young, not in the boys club. This was my first year entering that medical society. I was not U.S. Navy. I didn't have a military background. I was an outsider. And now showing that maybe we were doing something wrong, that it could be done different or better, and that we could treat these guys with neurological damage long after what the Navy had told us would work. And this goes to my personality. I wasn't deferent and self-effacing and aw shucks and I don't know if this works and maybe we got something here. No, I was so certain and so filled with excitement and emotion that we had a treatment for neurological disease. I wanted to shout this from the highest mountains. And so when I presented it, it was interpreted as very offensive, and there was tremendous resistance to it. I was pulled aside and told, "Do you know what your problem is, Dr. Harch?" I said, "No." Please tell me. They said, "You're almost evangelical in the way you're presenting this. Doctors don't want to see that. Just present the facts. Joe Friday, drag just the facts." No, there's no way to do that. When you see this affect these patients like I did and continue to, there's no way to do a Joe Friday, just the facts, because this can completely revolutionize the treatment of neurological conditions.